Smile makeover for $9.99. Perfect teeth in one visit. Celebrity smile overnight. If you've been on social media, you have seen these promises. Here's the truth. A real smile makeover is not just a trend. It's not a filter. It's not let me put that filter on Instagram and use it. It's not one size fits all. My name is Dr. Radwa Saad. Welcome to the Wonder Tooth Podcast. I am your host today. I have been doing dentistry for over 20 to 25 years now. So I've done it all. But before we keep going, make sure you use code DENT114, DENT114 to get a complimentary consultation from our dental office, even sometimes on Zoom in Princeton, New Jersey, Don Blanche Dental, or New York City, Fifth Avenue in Manhattan. And like, share, and subscribe to our channel. We are also on Apple Podcasts, on Spotify, iHeartRadio. You just write that Wonder Tooth Podcast and you sign up there and make sure you are following us. So today I'm going to walk you through about what a smile makeover really is. What is a smile makeover to begin with? What it truly costs, line by line. This is a very important episode today. And what you should expect before, during, and after. Because that part is always like missed, when you go to see a dentist, because you are investing in your smile now. You deserve the truth, not just marketing. So what is a smile makeover? So a smile makeover is not just one procedure. Let me do this, let me do that. It's a combination of few things done together. It's a custom combination of treatments that are designed specifically for your needs, for your face, for your bite, and for your goals. Okay, let's go back. For my face, why? Because the shape of your face, it plays a big role. If it's oval versus square versus round versus triangular. And of course, I want white teeth. I just want to be able to eat. I want to have a pretty smile. I don't care about the smile. I don't care about the shade. We get patients every day. Everybody wants something different. But a smile makeover, it may include dental veneers, dental crowns, teeth whitening, dental implants, clear aligners, or orthodontic treatment. And that's the whole combination of factors. Some patients may need one thing or two things or all of them together at the same time. Now, every patient is different and every goal is also different. My job as a dentist is to give you the options. Option 1, 2, 3, 4 to take you from here to your final goal. And we do this in a conservative way, and we do it in a scientific way, and we do it in an aesthetic way. Okay? You got it? So we're going to talk now about, I'm going to walk you through some of the cases that I get every day. So I have a patient, front teeth completely worn down. She hates the way how they look. They are short and they are discolored and they're almost brownish, grayish, and the gum line is not good. And she hates it every time she smiles. She sees like one tooth looks longer than the other and she has missing molars in the back. So what do? We need to fix this. So, okay. Teeth are worn out. Even if we decide to do some whitening is gonna change the shade of your teeth, but it's not gonna change the shape of your teeth. So we have to think about that. The shape of the gum, we need to consider that as well. So we take it one step and we each step separately. So the completely worn out teeth, it depends if you have fillings in these teeth or just they're worn out from grinding or from age. It also depends if you have apnea going on or bruxism going on. It's a lot of factors they get into this. But usually just a simple, everything is good and my teeth are just chipped or worn out a little bit. So veneers is a good option. If you have big fillings, crowns is another option. Teeth whitening is another option too. If you are planning to do maybe a few teeth, you don't want to do your bottom teeth, you just want to do the top or not the bottom. So teeth whitening can also, I like to use teeth whitening sometimes because some patients, once they do it, they're like, I think I'm good now. Okay. Then they come back later. They're like, okay, we need to do another round of whitening. Okay. But my job is to give you and you are giving me an informed consent. So with this particular patient, what we did was she hated the shape of the gum. So I ended up kind of recontouring the gum. It's called gingivoplasty. We recontour the gum a little bit so that the teeth can look, at the same height. So the front teeth, they're supposed to be, the two front teeth supposed to be a little bit longer than the two on the side, and then the same height as the canine. That's the aesthetic smile. You don't want to see a gummy smile. When you're smiling, you want to see like some gum, but also see more teeth. So the contouring, that's called gingivoplasty. And we usually do it with lasers, so there is no bleeding, no pain, nothing. It's amazing, and we do it on the same day. So this is like number one. Then number two, we do a little bit of whitening to kind of change the shade, the baseline of the teeth. And if the patient likes it at this point, then we're good. If not, then we can do some veneers. So dental can be composite, could be porcelain. I like the porcelain composite. Unfortunately, with time, composite is a beautiful material, but it can get the stain, absorb the discoloration. So if you drink coffee or tea or smoke or whatever, it gets discolored. Porcelain, they don't. Porcelain, it doesn't, ever had you're eating in that white porcelain plate and then it became discolored because you put some turmeric in it or something. It doesn't. They don't get, but we're not using the same porcelain, so that just to be on the clear here, but not get discolored. Now, missing teeth in the back. Okay, so we need now to restore function. So the gingivoplasty, that's more of aesthetic. Veneers is more of the aesthetic. Now in the back, I need to put some teeth because I need to restore the function. So you have options of, depending on how many teeth are missing, you have like one or couple of teeth, so you can get like implants is a good option. Partial denture is a better option if you have more missing teeth, or if your teeth are not gonna make it till next year, then we have to think about something removable or implant supported denture. But if you have like a couple of missing teeth, implant is definitely your best option here. And we can just do a little bit of adjustment here and there just to make the bite kind of and balanced. Okay, so basically it looks like as if we did nothing, but it was carefully engineered, one step at a time. Not do everything on the same day and be like, okay, go home now, you're done. No, it has to be done like steps. We usually call it priorities in the office. So priority number one, if we have gum problems, that has to be fixed first, like the foundation. If we have to do some fillings or gingivoplasty, that has to be number two. Number three, if we have to do some whitening. Four, if we're gonna do some veneers or composite or crowns. After that, we can do the filling, the implants. So they are based on, we're going to talk numbers. How much is everything? Because now we're talking big numbers. Yeah. So the dental veneers, the porcelain veneers, or called laminate veneers, these are not usually covered by any insurance because that's aesthetic. It's basically considered cosmetic. If you go to a dentist who are in network, even if they are in network, most likely that is going to be an out of, how do you call it? Like it's non-covered, it's a non-covered code. It means that the dentist will charge you their fees. And the fees are usually for a good porcelain veneer between $1,500, depending where you are at, to probably $3,500 or even $4,000 in the city. So it's where you are, location, and of where they are, if they are using like a good lab or not. And it depends really on the technology and the experience of the dentist. If fresh out of school is completely different than you go into a dentist who's been 20 or 30 years of dental experience. But usually if we do veneers for the front teeth, if we do it for cosmetic reasons, for like a smile makeover, then typically we like to do 4 or 8 or 10, depending on what you really want. So for example, if the patient has the 4 front teeth and they're like worn, they don't really mind the color a little bit, so a little bit of whitening will boost the color a little bit, then we can do the 4 front teeth. And if the teeth are completely worn out, like canine premolars are worn out, then we have to look at the smile. and where you are smiling, where you are basically which teeth are showing, because this is what we need to do. And especially I've had patients that are like, I want white teeth, so I cannot put 4 front teeth that are completely white, and then even with whitening, the whitening will fade away, after a year or two, and then so you have to think about that. So you're thinking about, yeah, that's clearly 4 or 8 or 10 veneers, depending on how wide your smile is. Okay, that's for the top and for the bottom. And some patients, if they are only having the top teeth are showing more, sometimes they just get away with some whitening on the bottom and just keep getting some whitening on the bottom and done. Let's say they need a crown. So how much is a crown? Depending also on if you have insurance or you don't have insurance, and if the doctor is in network or not in network. But usually insurance, they usually around between 1,500 to 2,500 a tooth. So that's a dental crown, and that's a porcelain dental crown or ceramic dental crown. So ceramic could be porcelain, it could be zirconia, which are basically the best material right now. Sometimes we have to do a porcelain fused to metal, if depending on the bite in the back, never in the front, but in the posterior area, if the tooth is too short and we cannot put porcelain or zirconia in the posterior area. So this is when the tooth needs more support structure, and depending also on how the shape and the height of the teeth also in the back. Okay, now the teeth whitening. So if there is like a teeth whitening out there, different, a whole different episode, guys. You have to listen to this one about teeth whitening, different things, teeth, the strips, and the one that you do at home, or the whitening, take whitening gel, you get the customized trays, you take it at home, you do it at home, or the whitening, that the professional one that is done in the office. So depending on what you're looking at, it's probably between $400 to $1,000 like treatment. But you, at least the one that you do at home, you pay a little bit more, but you leave with really white teeth, really white teeth. And then you also get like a boost kit, which basically it consists of customized tray with the whitening gel, and that you can use that probably after like a year afterwards. You can use it just to boost, your the new shade, the new whitened teeth. So that's, we talked about how much are the veneers, how much are the crowns, how much is the tooth whitening. Now let's say we need to do some gum contouring, the gingivoplasty, like if the gum, and a tooth looks short and a tooth looks long, and oh my god. So the gum contouring, that's called the gingivoplasty. It's done by tooth, and also depends in network, out of network. Are you going to use a blade to do it, or you're going to use laser? And the laser is expensive, of course, rather than this, because we have to buy certain stuff that comes with it. Everything is so expensive now, it's insane. So the laser and the gum contouring, it could be from ranging between $400 to $3,000, not for one tooth. Pretty much, I'm talking about the full gum contouring in the whole entire mouth, the gingivoplasty, between 400 to 3,000, depending, it can improve your symmetry and basically your smile proportion. So when you are smiling, the teeth, they look kind of equal. Not one is too short and one is too long. I'm talking about your front teeth. So imagine, from canine to canine, and then the premolars, if the gum is really low, then it looks like there are no teeth. So it's important for the aesthetic and the proportion and the facial symmetry too. Okay, now we'll talk about dental implants. So I place implants, I restore implants in my office, and in order to do that, we have to take 3D x-rays, we have to do the digital smile design. Also, we do that the same thing when we do veneers or crowns for the front teeth. And we don't even do it, like I have to send them to, he's a designer, he designs cases like this, and everything expense, but then at the end you're getting the best result that could be done, because this is when we put everything on the computer, the digital smile design, and we are basically using specific software to check your bite and how your bite is going to look like, if you are chewing side to side or forward, like we put it on what we call a digital articulator to make sure that afterwards your bite is comfortable too. So dental, they range between 3,000 to 6,000 a tooth. That's from placing the implant, if we have to do bone grafting, if we have to put a membrane, and also the healing abutment and the crown afterwards. So these are basically the prices. Now, That's basically each one. And of everything depends on if you have insurance that will cover or no insurance. Something very important that you guys have to look into, which is always in the fine print for dental insurance. I always tell the patients, dental insurance is very different from a medical insurance. Medical insurance, it will cover things no matter what. You just have a deductible and your copay. But dental, it's basically like a discount plan. You know, if you go to Costco, which I love Costco, I go every day, you buy a membership, which is the dental insurance, but you get inside and you still have to pay for the stuff that you are buying, but you buy them at a reduced price. That's basically what the dental insurance is. It's a Costco card. Dental insurance is your Costco card. So some stuff with Costco can be free, like, well, like the hot dogs is like, you know, but basically you still have to get that membership. If you want to buy like a vacuum cleaner, or if you want to buy some food, you still have to pay the price, but it's at a discounted rate. Basically exactly like what dental insurance is. So depending on your plan, some plans will cover crown, some plans they don't. And if they are covering crown and you had an older crown, when did you have that old crown placed? Was it 5 years ago or 20 years ago? Also depends. Or if you had a tooth pulled and you need an implant, do you have what is called a missing tooth clause, or you don't? What does that mean? It means like a condition. If you are getting, I don't know, some sort of, and if you had an existing condition, the medical insurance might not cover it. So it's the same thing with a dental implant too. Sometimes they don't cover a dental implant or a bridge because the tooth was being extracted before your plan started. So it's all about the fine prints. Veneers, most likely they are not covered because they are considered cosmetic. In my opinion, they are very conservative. So there should be some, but insurance is insurance. Sometimes, yeah, it's good at least to have your cleanings, your checkups and stuff, but you also need to have your function and your aesthetic, because that is important for you to eat and chew and keep your teeth for the longest time. So why they vary so much? Why something could be 400, it could be 1,000. Why something could be 1,500, it could be 3,000? Because of the technology that is being used, the experience, the technology. You know, if you go to a dentist like you go, and or actually some right now, and they are doing the gooey material, and that's the mold, and they send it to the lab, and then the lab is not the best, and the lab there is a lot of error. You know, when you are taking gooey material, a lot of error. So the crowns come back, they don't fit properly, or the shade is not good, or the shape is off, and they start to do adjustment. So technology, right? 3D scanning, 3D milling, 3D x-rays, which is called the CBCT, which is a CAT scan, 3D printing. We all have all of that in our office. So of, you know, technology, this is where we are. Like, you know, your old phone, your old iPhone or old Galaxy phone, the old one, the very early version was like, now it's like it is because of the technology that's in it. The cars, it's exactly the same thing. The cars, you know, ago, not even that long ago, 5 years ago, were a lot cheaper than the cars, even the gas prices. But you understand what I'm trying to say. Technology has a price, but it can really improve your function and your aesthetics and basically the outcome of the dental treatment. Experience, of course, is a big thing too, because, you know, I'm not saying anything, but you know, fresh out of school, they don't have the experience to go over if you're even a candidate to begin with, yes or no. If you've done cases, or they're gonna start to try on you, like you're gonna be their first guinea pig. You know, you have to think about that. And also the digital smile design, the custom design, everything is customized in dentistry, like a piece of jewelry, a customized piece of jewelry, not just a regular one. You want something beautiful, you want, you know, customized to your face, to your needs, to give you like a symmetry, facial symmetry and proportion, and has to be customized. So of course that also, you know, price. And the material that we are using, some materials, let me tell you, and I know some dentists, they will get whatever cheapest thing, and this is, you get the Smile Makeover for $9.99, and they don't even know where it's coming from, or even if it's FDA approved. We use the best material out there, like the very top of the top of the top, to ensure longevity, to ensure the precision of the restorations. Because you know what I tell the patients, it's not just your tooth that I'm fixing or your smile that I'm fixing. I'm putting, of my work, and it's like my artwork. I'm putting my artwork in there. So I have to make sure, I'm very protective of my work. Let's just put it that way. I put my heart and soul in it, and so team. So we want to make sure that it's going to stay, and it's going to stay for the longest time, and that you're going to be happy with it. But a poorly done smile makeover, $9.99, you're gonna redo this, and it's gonna end up costing you a lot more. I understand it could be an early investment, but down the line it will cost you a lot more if it's done, if it's not done properly. Now, we'll talk about Instagram versus reality, because of course a lot of the cases, that because I'm on Instagram too, you guys have to come and follow me at one point, but you see those beautiful, bright, uniform teeth, the transformation. There is nothing is done on the long-term care. And a lot of these, unfortunately, I can tell that they have been played with. A lot of filters have been done. I can tell. So you have to make sure that, of course, before you go to see a dentist, you have to really research before going there. But the part that you don't really see with all those white teeth, how they were prepared. Had a previous episode talking about how some teeth are shaped like triangle. That's not even a veneer. That's not even for a crown. They're over prepared. So that can cause a lot of sensitivity down the line. They look really fake. They're like bulky and thick. They look square. There's like no grading in the shade, no characterization in the tooth itself, the texture of the tooth, the shape of the tooth, the translucency at the edges of, there is nothing. It's just white, plain white, and square and thick. And they don't tell you anything about the long-term complications. So you have to be a candidate first. That's the first step. You have to be a candidate to be able to get this. And this is where you go to see an experienced dentist, so they can tell you from the very beginning, yes, they can do it or no, if you're a candidate for it or no. So real cosmetic dentistry is not about just a trend. Oh, you do the trend. No, it's about the balance, the biology, and the longevity. It's the art and science and the beauty of the aesthetics. Okay, that wasn't too much, but go quickly over how we do, like what to expect, step by step. What do we do for a smile makeover? So first thing really is going to be a consultation. We can do like an online digital, or an in-person complimentary. If you put that code I talked about at the beginning, we can do 3D scan. We can sometimes do simulation, which is incredible. Show you how the teeth are going to look from now to here, take you from here to here. That's the first, but you have to come in person. That cannot be done online, obviously. Then we can do what's called a trial mock-up, which basically the digital smile design. After we take a bunch of pictures, we put them, and we can how the teeth is going to look like. And then you come to your appointment. We basically numb you, and we start preparing the teeth. Sometimes we have, if you're a little nervous, we can give you some nitrous oxide, or basically some oral sedation to help you a little bit. And then after we put some temporaries that day, and then the following appointment, you come back and we numb you a little bit, take the temporaries, put the permanent, you look at yourself, big transformation, looks great. Then we have to put you in a night guard. Night guard is very important if you are getting a smile makeover, to make sure that everything is protected, depending on what kind of treatment you're getting. So could be a hard night guard or a hard soft night guard. Never a soft night guard alone, never. And it has to be customized. Don't go get the one from the from online or from the market, any CV, like, don't, because these can actually damage your teeth more, because they are soft. So when you are biting, the good thing about the hard or soft and hard, they're basically splinting your teeth together. The soft one, you bite on an off angle, and it can crack that tooth or put basically unbalanced bite and forces on the teeth, and can end up cracking your teeth or shifting your teeth even more. Okay, so you commit, you have to ask yourself and ask the dentist, Am I a good candidate to begin with? Yes or no? Do I have options? Yes or no? Is it going to be conservative or not? And how long is it going to last? Okay. So best dentists are not going to push the treatment. They will give you your options. They can guide you through it. But at the end, it's your decision. It's your informed decision and informed consent. And this is how you know you are at a good dentist or not. Okay. That was a good episode. I mean, just if you've been thinking about transforming your smile, don't fall for the shortcuts, because your smile is not just a cosmetic thing, it's structure, it's lifelong. We are at Dent Blanche Dental. We are in Princeton, New Jersey. We are Fifth Avenue in New York City, right in front of the Central Park. So come and visit us, connect through the, and make sure you share and subscribe to our YouTube channel. And don't forget to take care of your teeth, so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.